Blepharoplasty is an operation to improve the appearance of the upper eyelids. It can be done under general anaesthetic, but preferably under local anaesthesia if the patient is suitable. Most patients complain of excess skin in the upper lids, some sagging, difficulty in applying makeup, and a tired appearance which doesn't really marry with how they feel.
I've had quite a hard couple of years in my personal life, and so I think that's taken its toll on my eyes, sort of stress, not been sleeping very well, and I think those things combined have kind of aged my eyes over the last year, 18 months particularly. I researched quite thoroughly on the internet, and Charles particularly stood out to me because his background is in reconstructive surgery, and I liked the fact that he did as minimal invasion. He was award-winning, but I couldn't find anything negative said about him at all.
I'm a member of the BARPS, which is the British Association of Aesthetic Plastic Surgeons, and BARPS requires us all to do an audit every year of our numbers and complications, and I think any honest surgeon should be happy to be open with a patient about the numbers they perform, their complication rates and their outcomes.
He's got a very professional and comforting manner about him. He seems really interested in you rather than just what the procedure that you want taken care of. He was very attentive and considerate.
What I want to do is to have a nice incision within the crease running along where the natural fold sits. It will come out a little bit onto the lateral edge because there is a bit of excess skin here. The patient does it as a walk-in and walk-out procedure, and the advantages are that the patient doesn't require drugs that would make them potentially sick or nauseous. The patient doesn't have the costs linked with a hospital stay. The patient can cooperate during the operation. They feel less anxious having the operation. A lot of patients feel very worried about having an operation where they may be put to sleep and they worry about not waking up, etc. Those are irrational fears, but real ones, and therefore the ability to have this operation in this way is very powerful for patients. It's an operation that is very, very safe, but there are some things you need to know about. Now, the most important thing is bruising is universal. You'll have 2 black eyes after the operation, which tends to last for about 10 days or so, and pretty much all patients have the bruising gone by the end of the 2nd week. It's important that not too much fat is removed so that the appearance is natural looking. And what you should see after the operation is a nice even contour of the upper lid from one side to the other. Things you can do to minimise bruising are to sleep semi-upright, and the reason why that is that the blood pressure in the face, and therefore in the veins in the face, will be reduced by your head being above your heart. You don't want an operation to make a person look different or unnatural. The key thing is that the patient should look like themselves, but a better version of themselves.
Ralph Lauren sunglasses did the trick. Looked like I'd got a couple of rounds with a boxer, but it was okay because again, I knew it was temporary. I had the op on the Friday and the stitches out on the Tuesday, and Charles literally just stroked my eye and then just pulled it out, one long stitch, and I was like, is that it? Is it out? Putting makeup on is so different now. I can do it one-handed now. I don't have to stretch the skin to put my eyeliner on, which is nice. I felt like I was looking tired all the time and run down, and now I feel like I look well again.